fast-paced world of healthcare. Clear and effective communication is not just a skill, it's an art. I am your host, Dr. Simran Anand, and in this series, we dive deep into the aspects of patient interaction, focusing on one critical area at a time. In our first episode, we will unravel the complexities of information giving. We will explore real world scenarios where clear communication, from introducing a diagnosis to addressing financial concerns. Whether you are a seasoned physician or just starting your medical journey, these insights will equip you with practical strategies to enhance your patient interaction and foster trust. So buckle up and join us as we embark on a journey to transform how we communicate in healthcare and making every interaction more meaningful and impactful. In this special episode, we are honored to have Dr. Vishal Parmar, the author of acclaimed book, Mastering Communication Skills for Healthcare Professionals. Dr. Parmar is a distinguished pediatrician and neonatologist, renowned for his expertise and innovative contributions to pediatric care and telemedicine. Welcome, Dr. Parmar.
Thank you.
Dr. Parmar, let's start with first interaction with the patient. Imagine you are meeting a new patient who is visibly nervous and unsure of what to expect. How do you set a positive tone, gather essential information effectively, and build a rapport that encourages open communication throughout the visit?
See, there is no standard formula at how we can do it, to be honest. Because India, if we talk about India, it is a very vast country. Lots of culture, lots of regional languages, and how you greet the people, how you meet the people, how you talk to people. It might vary from region to region. So I'm saying it is not any particular formula, but more or less, I feel that whenever a new patient comes, first off, we need to take all this information like we are used to take their name, caregiver name, and how you are addressing locally. See, if in Gujarat they address Bhai, Ben, or G, whatever, call them by name, make them relax. If there is some more anxiety, then you offer them chai, coffee, pani, etc. And give them ear. See, non-judgmental listening is most important, because many times it is possible that we might not be able to fulfill their own expectation. It is not possible, to be honest, every time, because doctors are not jadugars, or they can fulfill every requirement for it. But sometimes they want to be feel heard, and how we hear them, how we take their concern seriously, and how we are able to address them, whether successfully or not, it is a different thing. This is what they begin to trust on us. Honesty is important, not to give false assurance. It is patient in the ICU on ventilator and you do not know what could be progress. Tell them next few hours are very critical and we might lose the patient, but we'll keep trying. But they will always have. Will he die? Will you be able to save him or her? Not to give false assurance, give honest assurance. So I think open listening, non-judgmental listening, asking open questions is most important to build the trust. And in India, there is a community system, caste system. See, the individual, family unit, or smaller family, extended family, or community or caste, sometimes the decision maker is some community or family leader. And or if not, still family depends on their approval. Because in medical scenario, day-to-day scenario, sometimes in emergency treatment, emergency surgery, so any other major or minor procedure, when he when it comes to going to take a big decision, patient and the relative relies on the uh, family or community leader about the approval for the particular decision. In that time, if they insist that please doctor talk to him also, talk to her also, we as a healthcare professional must include them because they trust on their particular leader, and if we as a healthcare professional able to convince them on whatever capacity or able to communicate them proper information which might help us to build the trust. So we should help them with each and every possible aspect ethically without compromising our medical ethics or giving false assurance. If we able to listen to them, then I think we might able to build a trust.
Moving ahead, these insights are actually very relatable because every situation that we see in the hospital, being it on the patient's side or being it on the doctor's side, it is very important that we understand that every human being needs an assurance, whether it may be in favor of their situation or maybe not favorable, but assurance is the only key that given by a doctor will always be helpful. But as you mentioned, that community leaders or head of the families, they are actually looking up. Suppose if some of the patients who are coming to your clinic, they might be having their elder brothers or maybe some elderly people in the family who are actually going to take the decisions on their behalf. So you have rightly said that talking to them will eventually be more helpful because they will help them taking a better decision. So that
Exactly.
is truly
See,
insightful.
see, my one of my great teacher, Dr. Y.K. Ambekar sir, used to say that every time as a doctor we cannot offer cure, but every time we can offer the care. So when we are not able to offer cure, please offer care because the care how we offer our care, the patient will judge us, and they know everyone knows that everything is not possible, but they want to see that how much honest efforts we are putting in our duty. That is more important. So when cure is not possible, offer care. That is most important.
Care is more important. Cure and care. So cure,
Yes, yes, yes.
yes,
Cure not possible every time, right? We are a
yes.
human. We are not magician or Bhagwan, whatever, or God, Allah, whatever. But care that and they have to feel that we are taking our honest efforts.
So, moving to a situation that might relate to you in your clinical practice as well, where patients are always hesitant in sharing complete medical history, or they might not feel comfortable, or maybe they are embarrassed or fearful about certain aspects of their health. How can you encourage them to provide a full and accurate history?
See, there are the two part of this thing. We as a practitioner should not expect that parents or patient or caregivers can give full information in one. Okay, because see they also have trust, and sometimes what it seems to important for us, it might not be important for them. Suppose we see that in something if you take the septicemia treatment, septicemia antibiotic is not most important, blood culture is most important. But for them, if the patient should be on ventilator, patient should be get extubated first. But for us, we need to take her internal.
Yes.
So at that time, we should not expect him to give all this information because first identify what is their main concern, try to address them. Then Once they done with it, tell us what is our big concern as a medical professional. Then try to explain them and try to explain the what can expect in coming days. Second thing, many times we ask the direct questions. Do you smoke? No. Do you drink? No. That is answer. If you are asking a question with answer which you expect yes or no, it might straightforward coming. Like आजकल कहीं पे स्मोक तो पहले हो जाता होगा नहीं मतलब open question. Sometimes many people do smokes. It's normal nowadays. Do you think you have smoked in the past? Yes, sir. I was. Sir, when did you stop? Before 2 days. Many nowadays alcohol is very increasing in young boys also. People are lots of drinking alcohol and without any control. There are a lot of drunk and driving cases happen. Have you tried ever alcohol in past? Oh, sir, I used to drink alcohol before 2 years. Now, I said, you let me know how do you stop. So, open-ending question.
That's
And
yeah, that's nice
whenever
actually.
whenever the patient comes or relatives caregiver comes to the OPD, as let them speak. Because sometime in a pediatric, if a mom comes to my OPD, I just ask her, come, sit down. Wait the child. Please wait your child and let me know what's wrong with him. Doctor, he was very fine day before yesterday at 7 p.m. It's just was little severing. Then we just measured the temperature and it was, oh my god, 103. And we have just give paracetamol, get a sponging, and after the paracetamol, it was very painful. During the night at around 5 a.m., he just got his full nose block, again started a fever. We gave the medicine. He's again fine. Then around 4 p.m., he again had a fever. Fever, we are giving paracetamol, but he's not improving. When there is a fever, he's so weak, and when there's no fever, he's playing like anything. Doctor, I'm just getting tense. What should I do? The mother is telling me that the child has a viral fever because in between the episode of fever, every child is fine. Mostly it's a viral. If we are going to let them speak in their language, they are offering us the natural history of disease. Do not interfere them to fulfill all your checkbox that
Yes.
oh, I have just completed my history. I should ask this. Let them ask the open question. Once you're done with it, can you try to ask close question to rule out or rule in something which you think of?
So basically,
So
you're promoting active listening,
exactly. Open-ended question. Active
open-ended
listening,
questions.
open-ended question. So history is not just history, but we need to dug out. But that is how we ask. If the experienced physician can ask with the history only, you can know the diagnosis. So in the world, the success story of telemedicine depend on the how detailed history you can ask. Because the more accurate history you are able to elicit, the more accurate diagnosis would be in telemedicine, and it will be more safer for the patient and doctor both.
So these open-ended questions will definitely help the doctors to actually get on to the diagnosis, because patients end up giving like yes or no answers. Usually it is like a logical type of thing, yes or either no. So it should not happen. It should be a detailed, as you mentioned, that the patient's mother was elaboratively explaining all the things to you even without you asking. So that should be the rapport building as well as the trust that the mother showed in you. And because of the nervousness, sometimes people tend to explain more. So we need to be patient while they are explaining things.
Most of that we need to learn how to give them ear. Give them ear. They
Yes.
will give us everything inside them.
So I think it covers both the scenarios, because initially I asked about the rapport building, and now when I ask about the history taking aspect, so both the scenarios are covered just by giving an ear to the patient or to
See,
the patient
these are
parents.
all the see for the clarity of learning. We are try to separate it, but at the end of the day, all are same intercollective also, right?
Yes.
Eh, we cannot start now is a history. We start from the first. Now is a concern. We start from the first. So that is how it is all interconnected. So that is fine.
So moving ahead with the next scenario that I might think of this time, since you mentioned that delivering diagnosis or maybe news, because diagnosis is a news for the patient, and now let us imagine a bit that if you are delivering a news of a new diagnosis to a patient who is anxious and might struggle with the complexity of the information that you might give them. So, how do you introduce the diagnosis clearly and compassionately?
See, first of something when you are trying to introduce a diagnosis to any of the patient, uh, just think that who is the patient and what is his support system. Because maybe a good diagnosis, good news or bad news, the support system might help us. So first of when we are going to give them some important information, we should uh, communicate with them directly in the keep quiet room without any disturbance, possibly switch off the phone. Clear them that if we are going to say the important something important about your reports or about their family member or whoever. And before moving forward, ask them, who are you? Means how do you relate it to the patient? If the patient is himself or herself sitting, ask who is a caregiver, how they are related. And apart from that, they want any other person to be present in this meeting. After that, slowly tell them, "Okay, you break the news. I'm sorry, but your report said that you might have some sort of leukemia. It's a type of a blood cancer. Whatever that is, then give them time to react. Do not see there are lots of information to give in leukemia. Whatever any, but do not expect every information we can give them same simple step. Suppose you as a pediatrician you attend to the labor room and you get the baby and you just do normal resuscitation and on examination you find that baby looks like a Down syndrome. So a person, your baby's, I think your baby's facial feature is something unusual. If we might feel that it might be some sort of uh, gene related condition, but I think let's do the blood report and confirm. Then we'll see what happens. And after that, what is Down syndrome? Down syndrome means your baby development will little bit slower side, or it might have some learning problem. But mostly childs grow well. Do not tell them that okay, when your baby is 5 day old, you tell them he might have a fertility problem in future. Every information should not be given. And whenever possible, you see people are emotional creature, humans are. And every human has a different aspect to express the emotion. Some become quiet, some become loud, some become angry, some become very emotional. Show them empathy, sympathy, and compassion. Empathy means that we can relate to the what we are feeling. Empathy, I had also done the same thing. Whatever, what you are passing through the difficult phase of life, I had also been passing. But believe me, everyone is there to help you. We as a medical team, as your friends and family, and if you have concern regarding financial, we have some resources or trust. We can give you context. They might help you. Right? The let's wait for the more reports and we can meet again and offer more information. And compassion data, don't worry, we are here for you. So need to practice and because human touch is most important. Like so told you now, when cure might not be possible, offer care.
Yes.
Care is important. So and many times it might require more settings also. So do this. Okay. And most important, document this because nowadays in medical legal era, it is important to document whatsoever communication we are doing. Get documented on particular so and so date, so and so time. We have talked to so and so person who is related to so and so person. Uh, and questioning this regarding the mainly the doctor who is going who passed the news is for so and so, and we talked him and take a counter sign. All this the responsible caregiver and the doctor, so that it might help us to save us from the medical legal aspect. And in the communication room, there might, if required, there should be audio-visual system also. It helps record all this conversation. So I think that is important.
Giving the information and then keeping a record of the information is equally important. So, and this is again an insight that I eventually learned from your communication right now. So, recording as well as giving care obviously is the most important key aspect that I have been noting down from the very first communication from where we started. And moving on to the
And one more,
yeah,
one
yes,
minute.
please. Yes, please.
Nowadays, patients or parents want information, and anyway they are going to go on Google. So, being a medical person, we cannot stop them finding second opinion or going to Google Guru. But as a medical professional, what we can do, they need information, we agree. They want information, we agree. And they want to know more, we definitely agree. So why should not we offer them standardized source of information to them? If requires some printed material, if requires some standardized websites, the standard website where authentic information is given or given on particular related disease. So if they are going to search the information by themselves, they will end up in random site and there might be some miscommunication. So it is our duty to provide them standard resources of information, particularly. And if they don't want information, simply I say, you want information, I agree. What you do, you have a pen and paper, you have a phone, whatever question arise in your mind, just make a note. Do not think that this is a silly question. There are no silly questions, there are only silly answers. So there is no nonsense type of question. You just write down, and whenever you want to meet me, just meet me in the meeting and you discuss your every concern. Don't wait. I can understand you have lots of concern, you have lots of question. Don't judge yourself that is a silly question. I won't judge you. Let us discuss whatever your concern because I know it is going to help you. So the information and information sources and about the frank conversation, I think it is important because after the breaking bad news, this phase will come. Many times parents want a second opinion. Fine. Or patient wants second opinion. Fine. There's nothing wrong. At that time, if they want, we can give them all we should help them. Or particularly, I say whenever in Indian scenario, many junior doctors find some resistance when it comes to share the information with other doctors. If someone's relative is in ICU or whatever condition, and they want them to, sir, this is our distant family doctor, or this is our doctor, or this is want to, will you talk to them? Obviously, we should talk to them. If we are going to do anything wrong, then we should fear that.
Yes.
Mostly, Any doctor is not going to do. Let us do that. But because it will help us to build the trust. Give them information. This particular patient is come to us in so and so condition. We give so and so treatment. Have report come. We are suspecting so and so diagnosis at present, so and so treatment, and we expect such kind of prognosis. And our plan is led. If you can offer you something more valuable opponent, please feel free. Or whatever your parents want to shift to you, you can go. Help them. So such transparent communication will help us to build the trust. And obviously, it will help us to prevent all this violence and whatever you can say that.
So, moving on to the treatment options, as we were discussing right now about that only. So, you mentioned rightly that there might be a chance that the patient has several options to choose, and he might even consider his family physician for a second opinion. So, basically, when you are presenting options to the patients, so how do you manage that? Because the patient might get confused that this might be right for me or that might be right for me. So presenting options in front of the patient is again a task. So how do you do that?
See, there are mainly two types of patients. Some they want that please give us direct option. We do not want any more information. Okay. And they want the information, but it depends on the situation. If it is an emergency, then you don't give them options. The first thing is to save their life. Okay. But if it is a non-emergency and we need to continue, the treatment option will come when you are dealing with the non-emergency condition mainly. And the condition might require surgery or a long-term medication. So at that time, you discuss each and every option honestly and know what is their view. If a patient is bedridden and we are going to do some procedure or start some medicine, we need to make sure that who is the one who is going to take care of him after the hospital discharge, how the family support system, how is the economical condition, what are the pros and cons of particular treatment, what are pros and cons of particular treatment, what are the evidence. So we should practice the evidence-based medicine and go accordingly. Yeah, but I would say that do not take the decision solely on the economic aspect. But because my personal experience says that the parents or patient, whatever's come to us to get treatment, they don't come to us to save money. We should help them. We should be sensitive enough to not to allow our hospital staff and everyone to spend unnecessary. But at the same time, the economic issue should not be barrier to offer a quality treatment. If they can, because what happens in case if we fail to provide a standardized treatment based on our economic decision and we do not follow standard protocol, the parents or patient are going to blame us only. In India, there is a saying, sir, please don't look at money. You can do everything you can do. Please don't think about the money. And at a time of billing, oh my God, so much money.
Yes.
There is a common dialogue at each and every hospital, and there is a trap also. Many young doctors come into such a trap, but do not follow your standard protocol and try to save the life first, then to save the money.
So, moving ahead with this, likewise, you mentioned that you can give them proper sources through where they can search their information. We discussed it 2 minutes before, I guess. So, based on that, there might be patients who might be researching already and coming to you and asking for your opinions on that, because patients do their research online these days, and then they would want your opinion as well on that. So So, how do you address this concern, or do you find it really to be a concern because it might end up giving them a misinformation? So, what is your thought on this?
See, in this case, there are two type of patients. Some patients come to us and asking us to give us a second opinion. These are the honest bit people, and some comes to us indirectly to have a second opinion. So the latter part, the person who is hiding from us, we cannot help them. But in this condition, how can we save ourselves? Is if we follow the standard evidence based medicine. So I think there won't be a harm and there won't be a much difference of opinion. There might be some different school of thought, but not difference of opinion. If there is a severe appendicitis who is going to rupture, some surgeon will also give option about the surgery, and other will also give option about surgery. So if we are going to follow the standard protocol, whoever the doctor he is going to ask might be the same opinion. So ethical and evidence-based practice will help us to come on the same stage. Whatever or whoever person they go to might come with the same opinion. So, and other part, for the manipulation part, we cannot help them because people are like this only, and we cannot change the people. Only we can change ourselves. How can we be better version of ourselves? How can we learn to deal such situation? And that is why I told you that the communication and recording of the communication is most important. The patient comes to you when they are asking about the advice. We should have communicate all these written documents. So if anything happens, the parents or patient won't going to blame you. Or many times the persons who is going to hide, who is hiding the state that they come to the second opinion. Mostly they end up asking a question about what the previous doctor has been given an opinion. So I think appendicitis is mild. We might wait. Let's give antibiotic for a few days, for 1 or 2 days. We might see if it can get control. Otherwise, we need to do surgery. So emergency surgery करने की जरूरत नहीं है ना. Something like that. They will mostly ask the direct or indirect question regarding the first doctor's opinion. What options the previous doctor given to us, they will ask us. Although they won't declare us that they came for the second opinion, but they will ask us. So with the experience, one can know that, they come for the second opinion. Okay. So better that we should behave like that. We should not give contradictory statement against our colleague unless it is grossly wrong. There are no difference of opinion. There are different school of thoughts. I don't say that everyone is wrong. Ayurvedic is right at their place. Homeopathy might be right at their place. Allopathy might be right at their place. But these are the different school of thoughts and different systems. You cannot judge them. Unless you feel that with this particular line of treatment or a particular line of management, the patient's life is going to be in danger or is grossly ethically wrong, then you must intervene. But otherwise, we should not contradict our colleague unless. And regarding the patient comes to us about the second opinion and he accepts us honestly, then you give them honest opinion and thinking that if we should not contradict or speaking ill about our other colleague.
And also the misinformation that is being floating because of Google. Because as you Google some symptoms of any patient might Google their symptoms, and then they end up having so many questions and as well as misinterpretations, misinformation. So how do you deal with that? Because most of your patients, because it's pediatric care and new age parents are more into Googling and all of these things. So how do you deal with that?
I just mentioned them. I allow them to speak. I allow them to speak.
Again,
I
an
give them
ear.
answer. See, suppose you are a mother, you have a question. Okay, you ask me. It's my duty to address your concern.
Yes.
Health is a mental, physical, and social well-being, right? In my pediatric, I'm treating physically child. I'm treating parents mentally,
Yes.
so that if mom and child is well, so their family social status will improve. So listen, yeah, I know, busy OPD, no time, but you can charge them extra. Just okay. If they want quality service in your time, don't charge them extra. You should have a guts. Or regarding the
Continuing.
source of, regarding the, I think we as a doctor fraternity, every specialized association, like Association of Physicians, Indian Academy of Pediatrics, or whatever, they should come with the nice information guidelines for the patients and parents and spread them. We should such information make available on Google so that everyone who wants to go to Google, they get authentic information from the authentic source. We should spread awareness data. We know you have a concern. This is a website. This is website from the authentic data standard association of the specialist doctor, and this is verified by so and so. This is supported by government. From here you will get okay. We should make such a resources and market it. People will come and give you some written information. Because we cannot prevent them. You cannot change the behavior of person.
Validating information is more important, that means.
Exactly. Because see the if you have some question in mind and if you are not getting the answer, it will harass you till you get the answer. And being a pediatric, if I'm not going to give the answer properly, the child who is going to lose.
Yes.
When mother is losing her mental peace, she might not be able to take care of her child properly. Because of stress, she might have a less feeding, less
Yes.
lesser milk secretion. So I think let us keep it simple. You have a question? Okay, ask me. I'm here to give you my ear.
That's an excellent proverb that has been said by you. I'm here to give you my ear.
So nothing else. Yeah, but uh, I will take charge. I will charge you for my time. You can have my time as much as possible, but it is my charge or whatever. And the same way we should, as a community, to come forward and do marketing of such standard information resources. So see the why communication is important. Personally, when I was in medical school or when I was a child, we go to the doctor. Doctor give us a medicine. We come back because no doctor ने बोला है तो करने का है. Simple.
Correct.
It was not like, and we have trust. So अच्छा भी हो जाता था. We never had a doubt that I should go for a second opinion. And in a medical school in the post graduation, no one taught us how to complain.
Absolutely right.
And nowadays, because of all this social media, everything, the more information, more videos, and there is a gap between the trust gap between the doctors and patients, and this trust is deepening wide and wide day by day. If public is a public, we cannot do anything against it. What we need to do as a doctor, it is our collective responsibility as a medical fraternity, healthcare fraternity. We should come forward and give our standard efforts to bridge this trust gap. Because at any point of time, the trust between doctor and patient is most important when it comes to the treatment out.
So, trust is a big word, I guess, because most of the patients tend to trust, and they even lose trust very easily because it's the matter of their health. But if a doctor like you is communicating so well with the patients and is giving an ear to them as well to hear, so efficiently the patient will also trust, as well as the patient will also believe in the treatment and have a very good treatment outcome. So, doctor, as moving ahead with this, some patients have financial concerns as well, and they are worried about the cost of the treatment, and they have limited financial resources as well. So, how do you address that?
To be honest, the location where I'm practicing, I'm not seeing any financial aspect. Maybe because of my geographical location, whatever. But I just give you an example. If you are hungry, right? It's not a generalized. I don't make it general. If you are hungry and you want to have a food, so you have 100 rupees in your pocket. Will you go to a five-star hotel?
I'll go to the place where I am economically fitting myself. So, I'll just opt for that.
So there is a common logic. Everyone knows that where they are going and how much they are going to spend.
But still, like the geographical
Still there,
condition, yeah.
still there, still, except for emergency condition, we should be transparent about our billing process. See, this is how we are going to charge you. Approximately this much day stay is expected. It might extend, but this is how we are going to charge. We should inform bill day by day or every 48 hours. If possible, try to take advance deposit as every hospital doing it. And we should have some context of NGO or a government scheme whenever feasible with us, which offer them financial assistance. Or if sometimes because of some so and so concern, if some patient is not going to afford treatment in private hospital, is possible, and sometimes there are some limitation where an NGO or government help might patient might not be able to get the government help and patient is sending money over. So we should offer them to help them to find out the cheaper or standard hospital where they go and take a treatment. And as a hospital, as a doctor, it is our responsibility that we should see the patient a particular hospital safely. If required, we might arrange the ambulance. If required, we might arrange the make sure the vacancy is there before we reach the hospital. If required condition is not stable, we should send our doctor in ambulance. Many times we might have to do it free of cost, but that is how humanity, as a humanity, we can offer.
Yes.
Okay,
So,
that we must do.
So moving ahead with this, as there are certain advices being given by senior doctors to junior doctors that never discuss financial aspects to the patients directly. Ask your staff to do it or your assistant to do it for you. So do you consider it right, or do we need to have certain kind of communication skills even to communicate this? And what should be the aspect that a doctor should opt for this?
See, the finance aspect in India, there is a whatever misconception I will say or perception. I'm not going to label it, but they see doctor as a noble profession, and doctor should not uh, charge or should not earn money, or whenever possible, doctor should do seva only. And as a doctor, when you are asking or discussing financial aspect, they will judge you that you are a money laji, money minded. So whenever possible, it is better to send the patient to appropriate person who is trained in financial counseling. It would be better option. If the patient asks this way, ask some discount, whatever possible. Let that particular person deal with us, and we can offer them. Many times, if required, in uh, many times in unavoidable circumstances, if the patient wants to meet the doctor, then they have to. You should meet them, but it should be your personal understanding or personal integrity or personal choice that how much discount or how much uh, concession you want to offer to a particular patient. It should be your personal choice. But generally, doctors should not discourage financial condition because of this system, because the common people will start judging.
So, as it is always said that the patient should not leave the hospital without any clear information being delivered to him. He should not be in a dilemma. So, how do you make sure, and what all things like you ask the patient, or maybe you might inquire that the patient has understood the diagnosis and is it all aware that what all next steps would be needed for him to get the cure done. So, how do you ensure that the patient is well informed and obviously he is all aware of the diagnosis and everything?
See, the standard communication doesn't mean a teaching. It's a two-way conversation. When you are trying to explain him, try to stick to the language with patient, which understood the patient. In India, stick to the Indian language only. I would recommend. Because Indian language or your mother tongue or whatever, this is a language where you can able to share your emotions comfortably. While speaking to English, you might able to speak it professionally, but when it comes to sharing your emotions, many Indians find it difficult to share their emotions word to word in foreign language. So try to use Indian language maximum whenever it is possible, and try to talk in the mother tongue of patients if you know that. And second thing, whenever you are explaining a particular condition or particular diagnosis or whatever, do not speak continuously more than 30 seconds. In between, try to answer question. Are you getting me? Do you understand this? Never require draw the diagram, take the help of some pictures or some modules and make them understand. In between, a patient want to ask anything, allow them if it is not interrupting your chain of information. You allow them. At the end of the day, end of the big conversation, always try to ask the concern. What are your Did you get it? मैंने जो बोला आपको समझ में आ गया? आपके मन में कोई क्वेश्चन है? अच्छा है? I'm going to answer. After it, देखो, फिर लास्ट में शॉर्ट समरी. हम दोनों ने ऐसा ऐसा बात किया है. दोनों ने ऐसा ऐसा बात किया है. ऐसे ऐसे पॉइंट इंक्लूड किए हैं. नेक्स्ट दिन जब तक रिजल्ट नहीं आएगा तब तक ये कंडीशन है, ये ट्रीटमेंट चालू करनी है. 2 दिन में रिजल्ट आएगा. रिजल्ट आने के बाद हम ये डेट एंड ये टाइम पे फिर से मिलेंगे. मीनवाइल कोई इमरजेंसी है तो दिस इज अ फोन नंबर, दिस इज अ एड्रेस, यू कैन कम एनी टाइम 24/7. And this is a information resources. If you want more information, you can go to this site or source. You can read it. If you have more concern or more question, you can ask me whenever we are going to meet next. You can make a note also. Is it clear? Okay. And this. The summary of conversation is most important, because what happens when I am going to give you information, because a person who is sitting opposite side of a table might not be able to focus on each and every words or each and every piece of information I'm going to give. Because there are lots of things going on in his or her mind. क्या होगा, ऐसा हो गया तो, ऐसा हो गया तो. So do not expect them to within the 9, 5 to 10 minutes of time. You might just able to focus on maximum 2 to 3 minutes. So summarization is most important. That you have discussed so and so thing. This is a summary. Is it clear? Many might surprise that the patient will ask to repeat the same information. We ask what happened. मेरा ध्यान नहीं था. Because उनके मन में क्वेश्चन होता है, कहाँ से पैसे लाऊंगा, किसको बताऊंगा, क्या होगा, कैसे होगा, अरे मेरे काम अधूरा है, क्या होगा. Because human beings are the social animals. इस सबकी रिस्पॉन्सिबिलिटी होती है. बच्चे को कैसे संभालूंगा, घर में कौन रहेगा, खाना कहाँ से लाऊंगा, अभी मेरे को पैसे चाहिए, कहाँ से मेरे को पैसे मिलेंगे, बैंक से उठाऊं या कोई रेफरेंस को फोन करूं, रिलेटिव को बुलाऊं, मतलब इंश्योरेंस में क्या होगा, इंश्योरेंस, मतलब देयर आर लॉट्स ऑफ क्वेश्चन गोइंग ऑन इन देयर माइंड एंड दे आर नॉट रॉन्ग आल्सो. So short summary before letting them go with agree about what next step is most important. And always in OPD always give them assurance that in case of emergency we should go so and so places, whatever.
So it was like a complete, I should say, walkthrough from the patient enters till the patient leaves the clinic or the hospital. What all communication we need to improve and to improvise a bit so that the patient feels comfortable, and at the end of the day he feels that yes, he has taken a good decision to come to you. And most importantly, it's more important on the humanitarian ground that the patient feels that yes, I was treated well. Because everyone gives the right line of treatment. Every treatment is same. We read the same books. We do everything same. But the only thing is the one who communicated well is curing the patient and taking care of the patient at the same time. This is what I have inferred from our conversation today. And Dr. Parmar, this was really insightful for me to know all of these things.
The communication works is final. See, you cannot learn communication while you are learning or while you are watching a video. You have to practice it.
Yes.
One cannot learn the surgery by reading the book.
Yes.
They have to hold the scalpel and try to do surgery under some expert guidance, and then they become independent surgeon, right? If you want to learn cycle, you have to sit on the cycle. You cannot read books by books or videos, then you can see you can learn the cycle. So the communication can be learned by practice. And everyone have to practice it in day-to-day practice. You are bound to make a mistake. But mistake is not a failure, mistake is a learning opportunity. And in India, in medical school, dental school, no one teaches us how to communicate with it. You know, nowadays we heard in social media or news that somebody comes and they beat the doctors, they beat the nurses. In most of cases, where is the problem?
The gap
might
is-
be proper. If we are able to teach basic classes of although communication can be learned with the experience and practice only, but if you know the basics of communication and how to deal with such situation in the dummy role playing scenarios, then it might help us to minimize the violence against the doctor.
Yes.
Government is going to make law, policemen will help us, but it is our duty to save us.
Truly.
Every time we cannot expect patients like this only. They are like this only. We cannot change the public.
True insights and based on true scenarios that you were saying. It is all relatable, I guess, to the audiences also who will be listening and who are listening to us. They will definitely relate to this. That whatever you are saying today is actually they must be facing this in their day-to-day scenarios.
You see, no one is thinking us how to, because when you were talking them, this is a book, you have to learn communication. Communication is not a, we know how to communicate it. If we know how to communicate, then why there is a loss of complications? I'm not saying that everything can be prevented by communication, but this is something that we can learn it or do it with minimum efforts.
So, Dr. Parmar, just because of my curiosity and asking, you are a pediatrician, and with so many years of experience, how come you have written a book on communication? That's a completely different aspect. Where did you find this gap? What inspired you to actually get into this?
See, there is a self experience. See, one, when I am from Gujarat. I studied in Ahmedabad in my medical school, the PG Medical College. I did my MBA in NHL Medical College and done my post graduation. Working in a government hospital, I have lots of work. To name it, I have seen. But what happened? It comes cases comes from birth asphyxia. How we are going to counseling? तुम्हारा बच्चा गया है, उसका ब्रेन डैमेज हो गया, किडनी डैमेज हो गया, लीवर डैमेज हो गया, मालूम नहीं तुम्हारा बच्चा पागल ही होगा, अब ये ट्रीटमेंट चल रहा है, कर लो इन रेसिडेंसी or in government hospital, whatever. I was used to do like, I don't know if it's right or wrong to say in those, but and when I come to the market, when I passed out and came into practice, so that fine tuning was not happening, and I faced lots of criticism or lots of things in my practice, and then I tried to give the MRCPCH exam, and where there is a communication station in a clinical exam. While preparing this station, I find out that no one has taught us how to communicate. It's not important that how much knowledge you have, because the common person doesn't know that how many inborn error of metabolism or how many other genetic disorders you know or you can diagnose.
Yes.
Because common is a common and rare is a rare. If you are a patient and you are going to ask me, sir, how many times I should give a paracetamol in a day? Okay, it's 4 to 6 hourly. For me, it is 4 to 6 hourly is very common. But for him or her, it's a very new information. And I should not, मुझे चिल्लाना नहीं है, इतना नहीं वालों को 4 से 6 घंटे भी चलता है, ये नहीं है, वो नहीं है, मतलब गाय का दूध क्यों दिया, गाय का दूध तो बच्चे को नहीं देना चाहिए। अरे यार, वो गाय का दूध इसलिए देती है तो उसके पास पाउडर के पैसे नहीं और उसको दूध नहीं आता है। प्रोटोकॉल फॉलो करना इजी है, बट जीवन दे सकता हूँ, और उसके ऊपर भी सासू माँ का प्रेशर है, सोशल प्रेशर है। बीइंग अ पीडियाट्रिशियन, मुझे तो ना सास बहू की मीटिंग अटेंड करनी है और मुझे कुछ नहीं करना होता, झगड़ा सोल्व करना होता है, तो बच्चों अपने आप ठीक हो जाता है। तो देर आर हमारे यहाँ पे, तुम्हारे यहाँ पे, हमारे यहाँ पे, इट इज ऑलवेज मोस्ट ऑफ 80% टाइम गोइंग। So then one of my senior doctor, Dr. Somsekar, and I tried to connect with the Indian Academy of Pediatrics that no one is teaching us the how to learn the communication.
Yes.
Can't we arrange the communication skill workshop that where we make a dummy scenarios and make them do role play and correct them? Because it is better to make a mistake while you are in training than in your consulting room or in hospital. So then my senior supported me, and then my senior Dr. Somsekhar Nimbalkar has come up with the idea that why should not we write a book? I never thought of writing the book. Will you help me, because I do not have any experience how to write the book? And he guided me, and then last year in the Indian Academy of Pediatrics, the annual conference in Kochi, Kerala, we have released it. And now we are trying to plan to introduce a communication workshop for pediatrician with IAP for a 1 day. Let's see how this goes. The same way, I think, and for the second book, I thought there's an EdCom module in MBBS.
Yes.
It is based on communication, and I think I have a chance if I have learned. I didn't have any particular training in communication or whatsoever you can say that. But based on experience and self-learning and whatever, I just tried. What if I write a book for the general healthcare professional covering the common scenario? Let me try. What's the wrong in trying? So I just come up with this book and we see how to up it fares. That's all. Because the intention behind it to solve the problem that as a medical fraternity, my duty is to build a trust gap between the doctor and patients. And it can be done by proper communication. That is my baby step. That's all.
Yes. So that was like really enlightening, I should say, and it is a sort of alert that this episode will create in most of the healthcare professionals' life. Because most importantly, the things that you have highlighted are really very small things if we consider it, but very important at the same time. People might think that they are okay, like if someone is not listening to us, that's fine. Even on the patient side, they might not consider all of these things to be very important when discussed in such details, but when they are practicing it and seeing the changes, they might feel the change that they are having when they are using such tips and tricks in their own communication to deliver a better treatment outcome or deliver anything in life. Because this is not only related to healthcare, I guess this is completely a holistic approach that how we should talk and how we should communicate our thoughts.
Yes, see, I'm feeling that every nursing home or every hospital should have a training of the all staff, from starting from the class 4 to nurses to administration to doctors. They should be trained simultaneously and how to communicate with patient and relatives, caregivers. Because if everyone is on the same line, it will help us to build a trust. And what to do in case of emergency, they should be trained. And this is a skill, and
Yes.
they can teach their staff every year with 1 day workshop if they want to, because it will help them to decrease lots of confusion and lots of daily college, whatever you can say that.
This
So many times,
communication, yes,
yes,
is a
yes,
very big gap. Actually, not actually a gap. It's a bridge. Miscommunication is a bridge at the moment. That needs to be repaired with the help of good communication.
yes, many times there is a communication gap between the healthcare professional also.
Yes.
What commonly shift when the shifts are changing, they don't give proper handover.
Yes.
Most commonly, they don't give proper answer to nurse. Most many time nurse don't want to communicate with particular doctor because he's always chillata hai, right? So this kind of things happen.
Yes.
So it is important that communication skill सबको learn करना चाहिए. And how, see, the communication is not about just how we speak. It's about the body language. It's about how we write our notes, how we communicate with our colleagues. Sometimes, if some doctors in the cross reference give other opinion and your opinion is contrasting, then it should you have some guts to discuss with the doctor why you have given such. What is your logic behind it? It is possible that our thinking might be wrong, his thinking might be right. But if we're going to talk to them, we will learn. इट इज नॉट अबाउट द ईगो कि उसने कुछ चेंजेस दिए तो मैं उसको नहीं दूंगा, मतलब इट इज हाउ वी गोइंग टू लर्न.
Clarity is very important. Whatsoever it
Yes,
is, just ask.
yes. Because many times in a hospital, if the nurses proper communicate properly, the doctor communicate, the class four is not going to talk. Can class four can spoil the scene? Many times it happens, especially in government, whatever. So the communication training to each and every hospital staff or healthcare professional is must. I feel that.
That's absolutely true, because miscommunication brings in no space for a better communication there, because it becomes a very big clash that needs to be cleared by a collaborative approach at the same time, but again it takes time. The damage once done because of miscommunication is done till then. So just to avoid any kind of damage that can be avoided, or maybe there should be no damage because of miscommunication that happens. Maybe sometimes in some medications, not giving proper instructions to the nurses, or maybe nurses not taking proper instructions from the doctors. So it's a two-way thing that needs to be solved, and that is a very right agenda that you have highlighted through your book and maybe through your workshops, and it should be followed by every Indian medical college, dental colleges, and everywhere. It should be for every medical practitioner. It should not be restricted to medical or dental or maybe nurses. It should be for everyone.
Yeah, see, at the end of the day, everyone wants is a peace of mind. When you see the being a healthcare professional, being a doctor, when you go to the home ना, एक कॉन्स्टेंट fear रहता है. अरे कुछ भूलने गए ना, अरे कुछ मतलब इन केस भी हॉस्पिटल से फोन आता है ना, अरे क्या प्रॉब्लम हुआ अभी. कॉन्स्टेंट मतलब वो as a doctor we cannot refuse a call that like every other professional does it after office hour. You cannot contact me. We cannot do like this, right?
Yes.
हम लोग नहीं कर सकते हैं मेडिकल प्रोफेशन बिकॉज वी हैव टू बी ऑन कॉल. अभी फोन आता है, क्या हुआ, कांस्टेंट रहता है that we can and see this next generation is जो आ रही है next Gen Z. This generation is very ill patience. They do not have patience or and capacity to work under someone like the previous one, and there are lots of problems going on because of this everything. Let us, it is going to be the different topic, but if we able to train them how to work in a team, because in future the medical care is a teamwork.
Yes.
As a single doctor you may not be able to open your small nursing home and run the show, because patients are becoming demanding day by day. They want good quality care, they want everything, and their spending capacity is going to increase, and at that time they want everything best.
Yes.
So and the डॉक्टर भगवान होता है वो वाला कंसेप्ट गायब हो रहा है. देयर आर नो मोर डॉक्टर पेशेंट रिलेशनशिप, देयर आर द कस्टमर कंज्यूमर रिलेशनशिप more of nowadays. So the team practice is necessary in coming days, and when we are working in a team, the proper communication is what most important.
So the topic has ended, but the conversation is like endless, because every time we are discussing something, we have a different thought and a different insight on that. And that is because of your immense experience that holds a lot of insights from the day-to-day experiences that you hold, and from everything that you have gathered up till now. And it was so well explained with the help of experiences, your day-to-day communication with the patients. So it was all very flawless and enlightening at the same time. Thank you so much, Dr. Parmar,
Yes.
for your time today. And before we conclude, I would love to hear your thoughts on the MedSynapse platform. How has your experience been, and do you see it benefiting the medical community?
See, MedSynapse is growing well, and I wish you that you become a trustworthy partner when it's come to the medical community, like मेडिकल हेल्थ के प्रोफेशनल का सोशल मीडिया बन जाओ.
Definitely. With doctors like yourself supporting us, we will definitely be the one that you're hoping us to be, and we are really happy with this insight of yours.
बहुत सारे लोगों के पास बहुत कुछ है, एक्सपीरियंस है, और उनको शेयर करना है कि that is how we can make a thing differently and make thing better. So I request you to please give them platform so that they can make a little change to make our healthcare professionals like better, and at the end of the day we can treat the patient better.
Definitely. And moving on to this, so together we are going to do many more episodes on the topic that we have chosen. And to the audiences, thank you for listening us today, and don't miss our next episode where we will have explored the critical topic of informed consent. We will dive into how to effectively obtain and document patient consent, ensuring that patients fully comprehend their treatment options and agree to the proposed plans. To our listeners, thank you for joining us today. And if you are a healthcare professional who would like to voice your insights on our platform, please contact us. Together, we can continue to drive meaningful discussions and advancements in healthcare. Thank you for joining us today on MedSynapse. Stay tuned for more such discussions on advancing healthcare innovations. Until next time, take care.